All right, good morning. What we're going to be doing is going over chapter 5, dealing with pediatric considerations. You want to look at the objectives and the terminology, and you want to make sure you're looking at the different patient safety, look at their culture, look at their age. There's a big difference in changes in the amount of medication, how it's absorbed, the metabolism rate. So all these different things you're going to have to consider in patient safety with pediatric pharmacology. So with that being said, we're going to make sure we're going to explain the differences and the differences that exist in drug pharmacokinetics and for pediatric patients versus adults because of the differences in the body composition and organ maturity. They appear to be more pronounced in the neonates and the infants than the older children. Now, and we're talking about absorption, distribution, metabolism, and excretion. Really, you that want to go on further and get into NICU, or get into pediatrics, you have to understand there's so much more safety involved now in the way medications are prescribed because of the fact it's based totally on weight. Now with the protein binding compatibility and effectiveness, the various barriers to medication transport as affecting with the distribution of the medication throughout the body of a child. Now you're going to want to review and make sure you know the like pharmacology, and you want to know the calculations on, say, for instance, if you have a 20-pound child, you have to break it down into the kilograms because that's how it's based. And then, so, for instance, 80 milligrams times 9.1 kilograms equals 728 milligrams per day. So you divide it up into 3 doses. That's not 728 milligrams each dose as for a adult or adolescent. You're going to have only 242.67, and it's precise. You got to use that milligrams per dose. So you are going to have to learn how to educate the patient's parents and how to make them understand because the anxiety level is going to be really high. You want to have how to instruct the family members how to administer the drug, and especially with young parents, you're going to have to tell them just because the child's feeling better, don't stop taking the medication. They have to take it until as it's prescribed, usually until it's gone, or 10 days usually is the window, because the compliance is the issue you're dealing with family members. So you want to I'm going to go on with the slides here. Like I said, we're dealing with absorption. Those are influencing factors: a child's age, health status, weight, because you're going to have young children now in elementary that weigh 200 pounds. and it's a lot different than it used to be, because you have to consider, yes, you have to take it. You can't always go weight in that issue. If you do, you're going to over medicate. So, because they metabolize it different. So there's a lot of key factors you have to look at. You're going to start looking at different things with children to check out what their underlying factors are. And you have to observe if they have what their symptoms are, because their gastric emptying, mobility, everything is sped up. And so you have the IM, sub-Q, the peripheral infusion, effectiveness of calculation, and topical. Children's skin is thin and porous, so you see a lot of Phenergan given to the child's forearm or the wrist, inner wrist. The distribution, influencing factors. Just know that you want to know that there's significant differences in the drug pharmacokinetics with pediatric populations. These distinctions stem from differences in body composition, organ maturity, appear to be more pronounced, like I said, in neonates and infants, but significant in school age and adolescent children. Refer to Table 5.1. We've already gone over this as the metabolism. And the excretion, the kidneys, unless they're compromised at birth and they have a history of it, they have great renal blood flow. There's the filtration rate. Everything works much better. Now, the degree of like the rate of absorption, and the absorption becomes more effective as the child grows and develops. It's significantly important to obtain weight and be assured of correct dosing in children. Now, metabolism takes place primarily in the liver. Infants have reduced hepatic flow, blood flow, and the drug metabolizing enzymes. By the time they reach 1 year of age, hepatic blood flow has reached that of an adult. So therefore, it gets to a point where they can excrete it normally. But a child after one, their kidney and their blood flow are great. So the important to understand the isoenzymes involved in the cytochrome. Now look up that, and it develops at a rate and demonstrates individual variation. Renal excretion is predominant, means a drug elimination. The glomerular filtration rate in terms of neonate is roughly 30% of that of an adult. Now, with mechanisms of the action that affect the drug on the body includes onset, peak, duration, and the effect of the medication, intensity of the therapeutic effects, and adverse effects. And that's all related to what I just talked about. and how they absorb and how their renal function and the hepatic function correlates with the age and the medication. Now, the variations, because of that, the factors will affect the drug half-life in pediatric patients, and it is the impact on drug dosing. So you want to, so therefore you want to monitor that drug dosing in the first 15 to 30 minutes, especially on the initial dose. You want to monitor the therapeutic effects and adverse reactions, and especially when you're given a immunization. You see that so many times that people do not watch that. They take it for granted. Oh, well, just take some Tylenol. But you really need to educate the parent. If they're going to go home, you want to look for specific side effects that they may encounter with that specific immunization, or especially with the live virus, because they may have an allergy to that specific immunization. Say, for instance, a common one is people that have sensitivities to egg products, or anything that is that shows up in the way of a rash or fever that does not go away within 24 hours, and any elevated temp and severe swelling at the site. Just make sure you maintain the safety of the patient. And you got to really involve the family, because you're not really treating one patient, you're treating two, because of the fact that you're dealing with the family. Now, the calculation of medications, like we had just gone over the initial beginning of the chapter, is based on the FDA recommendations, and the pediatric dosing is now available for over 450 drugs. And like we talked about in the first chapter, this has come about because of the fact it is actually more medications are being tested on young children. So for those drugs without pediatric dosing schedules, dosing is based on approved protocols. So you look in your drug book and see if it's based on the weight or what you just follow guidelines, research studies, and provider experience. And now this is talking about the different implications and how the patient's going to be. After a traumatic experience, you're going to deal with a child that's pretty, they're not able to be controlled. So you're going to have to make sure, don't get the parent holding the child down. Get another nurse in there, because when you're administering that medication, and especially with a traumatic experience, you don't want that emotional memory to be related to the parent. So make sure of that. Don't put the parent in the situation where they have to be involved in that situation. Or now oral administration, subcutaneous, intramuscular, intravenous, and then you have the etetic mixture and the local anesthetics. You have the decreasing pain, anxiety, distraction, diversion, relaxation, creative imagery. Like if you go down to Texas Children's, they always have a therapy nurse, or they could be PT that comes in, or occupational therapy, that will come in and have child play and to reduce anxiety when they're doing a treatment. Say, for instance, allergy testing, and you want to divert or distract the child while you do that. So we're going to look at the Pediatric Drug Administration. The intravenous sites, usually you're going to use the forearms, and you have to use a arm board and secure it with like Herlex to make sure they don't have access to pull it out. Just make sure, have respect for the child, age appropriate teaching, positive reinforcement. Now, in adolescence considerations, you want to need the individualized care specific to the development stage and the maturity, because you have physical changes to deal with. So many different changes are happening at different ages with male and female. You have differences in cognitive levels and abilities, social reasoning, emotional factors, dealing with family matters at home. Are they foster children? Are they abused? Different things that'll be in play. Independence from parents. Sometimes you want to ask the parents to step out when you're asking some questions that they might not want to divulge. So self-care behaviors impact chronic illness. It is important that the nurse differentiates between the child's development of age and chronological age, because the difference has the impact on the child or adolescent's response to the medication. Now, the patient's ability to understand the process and the reason of the drug administration and the need to cooperate with a procedure must always figure prominently in the nurse's plan of care. The nursing process, family-centered collaborative care. Assessment. You want to know the age, weight, height, developmental age, health status, allergy history, nutritional hydration status, cognitive level, family, child understanding, and history of drug use. Potential nursing diagnoses would be knowledge deficit, health maintenance, ineffective, knowledge readiness, injury, risk for, or you can say risk for infection, risk for, depending on the situation. And you have your planning, what you're going to your goals. Child, family members, and caregivers will recognize the need for drug administration, child and compliance. Child members and families and caregivers will incorporate the drug treatment regimen into their lifestyle, and child family members and caregivers will demonstrate drug safety and administration practices. Now, one point I want to make out is this. After I'll go over this, but then I'll want to go into one a principle that I want to talk about. This is the nursing interventions. I want you to just go over this and know these, because you will be doing pediatric care plans. Nursing process, family-centered collaborative care, evaluation. And so here's some practice questions. But before we go over to that, I wanted to point out the Dr. Wong, principal of the autotraumatic care philosophy of providing therapeutic care through the use of interventions that eliminate and minimize the psychological and physical distress experienced by children. That's when it started. She was named for that. Based on the cognitive level of the child, non-pharmacological methods of pain and anxiety control, such as distraction, diversion, relaxation, creative imagery, may be used to decrease the perception of pain. It's much easier to distract, when you have a child that's jumping off the table and running underneath the table, and you got to learn to distract instead of just chasing after them. And you have to do something to prevent a lot of that. Adolescent patients need to be individualized nursing care, specifically with their developmental state. You're going to see a lot of different emotional factors in adolescence. Family and patient teaching is a key role. And we keep on going over family teaching because that is a big safety issue. So administer and how they administer the dose and to the point of therapeutic effect, and then monitor the duration. Always follow up with the parents and see how they're doing. If it's a clinic stay, a lot of people miss and they have return visits with high temps because of the fact that the medication wasn't given throughout the duration that it was recommended. So they look at all that and consider all those factors. And so just go over the practice questions. Children have a higher metabolic rate than adults. The nurses realize that the effects of the administration of the medication for pain in children in all of the following except. So which one would be? I would think A. You want except you don't want to have a higher requirement for medication. You want to have increased dosage. Really, it would be B, because this requirement is the word that could actually make it correct. So increased dosage is not. And then so practice 2 question, go over that. Practice 3. Now, you know that one. We went over that. That's all age, weight. But key factor is weight. But all of them would make a big difference because you have to put all of those into play, especially in pre-adolescent and adolescent. If you have any questions, let me know. We'll have just go over all the resources made to you, and we'll go on to the next chapter. Okay, thank you very much.